Austin-Weston, the Center for Cosmetic Surgery, is proud to present the New Now podcast, today featuring Dr. Byron Poindexter. And now, here's your host, Rebecca Bennett, and Dr. Poindexter.
So today we're talking about surgery post major weight loss.
Yay.
Yay. Yeah, always exciting.
If you watch our Instagram feeds or anything like that, you will hear me say yay. That's generally, it means I'm happy with what we've just done, and it's time to stop filming that particular portion of the segment. So
that's like your sign off.
It's my sign off. Yeah. So like yay. Okay. On to the next thing.
I love how you guys do those Instagram stories because it kind of gives us a look into the operating room. I typically, maybe it's because I just kind of have like anxiety about surgery, is like the sound of the heartbeat monitor in the background. Mm-hmm. It always gives me, like, it freaks me out. And I think it's kind of like nice to see, like, it's normal. Hey, yay.
Exactly. Yeah.
Yeah. In the operating room. How long have you guys been doing that? Kind of taking your Instagram viewers. Do you know how long you guys have been doing that for?
Probably, whenever Instagram started, then we're probably about 6 months later.
That sounds about right for you guys.
Yeah. So, as soon as we found out that it was a reasonable thing to do in a professional manner, and a good way to share information, that's probably when we started.
Do you ever have patients come in and say, "Oh, I saw this on your Instagram"?
Oh yeah, yeah. It's not uncommon at all. We see it a lot for probably body surgeries, a bit more than face surgeries, but also on face we see it a lot for things like Botox and filler.
Yeah.
Plump lips are a big thing on Instagram.
Yeah.
Sometimes overly plump lips are a big thing. And I will throw in my kind of caution about that, is that what you're seeing a lot in those instances are not results. You're seeing the immediate effects of something that's been placed into the lips or into the cheeks, highlighted with a little bit of Vaseline to make it look shiny and new. And it's like, look at what we just accomplished. Well, no, that's what you accomplished and what it looks like here, 3 minutes later, but that's not the result. The result is, weeks and months away. So when you see something on our Instagram that is a before and an after, that is at least 3 month result. Mm-hmm. So now we're starting to see something that looks like a result after the tissues have had time to have the swelling go down. Mm-hmm. They've had the time to relax. They're not overly altered in an unnatural way.
Yeah. In a past episode together, we kind of talked about the effect of social media on your industry and people coming in and saying that they want something that might not be attainable. So it must actually be really nice for someone to be able to maybe go on Austin-Weston's Instagram and point out something that they like.
Right. So there's the Instagram, which then, of course, leads to our website, which is kind of the mothership of the information. So yes, you go to the Instagram, you get a brief glimpse about who we are, either through a post or if you're there at the right time, through a story. And then let it take you to the website where we have the information in a more robust form with lots of before and afters, with lots of educational opportunities. And
one recent post that you had, I was nerding out over it. I just think it's so cool, these major weight loss surgeries. Mm-hmm. They're very, very cool. And it sounds like most of the time you're doing them in multiple parts, right?
Correct. So there's a category that we call massive weight loss. Mm-hmm. So that's the term that's used probably amongst plastic surgeons for patients who have either had an operation that's allowed them to lose a lot of weight or who on their own have lost a lot of weight. And there's a great number of those people as well. So when you have somebody who's had a massive weight loss, and that depends on your frame. If you're 5 feet, a massive weight loss might be 60 or 80 pounds. But a lot of these patients have had 100, 200 pound weight losses, things like that. And then you have a lot of excess skin in a lot of areas. And when we operate on these patients, we really tend to do this as staged procedures. So staged meaning not like a stage production, like, hey, kids, let's put on a show. It's staged in that we have stage 1 and then stage 2 and then potentially stage 3. so that we can do things safely, and also to get a good result at each stage. So you could do multiple stages kind of halfway, not so great, and maybe stay safe. But it's the best is to do them well, and then to separate them in time.
That sounds nicer on the patient too, with recovery.
It is, and I think it's helped my practice to have patients do well postoperatively, because they'll come in, they're like, "Oh, my friend had this and it was horrible, and she came by and she saw me today and couldn't believe, how well I was doing." Now, I don't want to go out there and say that no, my patients have it so much easier than everybody else's. No, but we have a process, we have a system here that allows us to do that. We've done it for so long, and we have such great staff that they've brought us things to help with postoperative pain management, special protocols to deal. So not just relying on one medication, but choosing 5 that act in different ways in small amounts can improve it. So we've had a lot of experience, which helps us to kind of refine and or perfect the postoperative process.
And how do you decide what to start with? Because I know in the example we've been referring to, you started with her underarms and a breast lift. How do you decide?
Yeah, so we earlier, before we were looking at a recent Instagram story that was up that showed the intraoperative aspects of a body lift, in particular one that was a fleur-de-lis, where we remove a bunch of skin at one time. And if we can slide it in here somewhere, the warning, slightly graphic, but it's surgical. So how do we decide what to do? Mainly what bothers the patient most. That would be my prime focus. It's like, okay, what is the biggest? Because they usually have a number one. They say the thing that really bothers me is my arms. I think, like in the patient that we have, that's like her arms and breast, we felt we could do together, and her arms, she couldn't get them into sleeves, because it was just so much skin. And that was her prime focus. A lot of people, the prime is their tummy. It's the way clothing, they just don't feel comfortable sitting, because there's all the extra skin that's getting bunched up in different areas. It inhibits their ability to exercise and do some things like that. So that becomes their prime focus. So it's not uncommon for us to start with something around the abdomen, maybe combine one other procedure with the abdomen, depending upon how big or small they are, and then kind of go out from there.
So in this particular case, about how much time passed between the first surgery and then the one that you just performed?
I think that one was probably close to 3 months between, which if patients have that much time, I generally like it to be that, because as I will explain it every chance I can get, we can do a really nice job, but we can probably always make something a little bit better. And especially in one of these massive weight loss patients, their skin doesn't behave like someone who's lost the weight either naturally without a gastric bypass or just hasn't lost that much weight. Mm-hmm. So you'll get them very tight. And then 3 months later, it'll be loose again, more so than either one of us would desire. Even though you did a really nice surgery and got a great result, things get loose. Now, with patients who've had a gastric bypass, we think some of that's dietary. They don't absorb things as well, so their skin, but it's also just been stretched so much, so that sometimes a patient who lost it on their own has the same issue. All right, so if you separate it by 3 months, now they've not only recovered physically completely, but they've healed enough that if you need to come back and then touch something up, it's easy to do while you're doing that other next big surgery. So in the case that we were looking at, I added 15 minutes of improving something around the arm area while we were doing, 4 or 5 hours of surgery someplace else.
And is that just like reopening a scar and then?
Yeah, it's probably cutting out the scar, or making the scar a little bit longer. It's like, oh, it got a really good job up to here, but now this area looks loose relative to what it did before.
Gotcha. And then it makes me laugh that it's called a fleur-de-lis. Mm-hmm. Can you talk about what exactly that process is? And do you do that with every every major weight loss when you're removing? Is it always a fleur-de-lis to remove the skin?
It is not, and so the fleur-de-lis is a kind of a 3-pronged, surgical skin removal, and it looks like the fleur-de-lis that is common on a New Orleans fence post. And I think in the video I tried to remember if it was a Boy Scout or Cub Scout symbol that has kind of like this, something goes this way, and goes up. Mm-hmm. So that is if somebody has a lot of laxity from side to side as well as up and down, and they're not going to be bothered by that scar. So we have to walk the line and say, all right, I can do this surgery without the scar, but you're going to be a little bit loose. But would you be more comfortable having a little bit more looseness to your skin and not having this up and down scar on the tummy? And for some people, they would make that choice because they know that their other incision, their other scar is going to be down in the underwear line or down in the bikini line. And the incision around the belly button is going to fade and going to be very difficult to see. So now they're not really going to have as much visible scars, but they'll have more looseness than had they opted for that up and down incision.
Mm-hmm. And then after that was the buttocks area too,
so
that you were lifting?
In the buttocks, that's really an extension of the abdominoplasty. And the case we did was actually what would be called a body lift or a torsoplasty because it went all the way around and removed loose skin in the lower back and the upper buttock as well.
Are you able to do that in the same surgery?
Yeah, that was all done, and that was all done in one surgery. Yeah.
And I did notice in that story that you kept referencing that you had pulled the fat previously from her before the surgery. Were you doing liposuction on her first?
So sometimes in a staged procedure, we will have done liposuction at a prior time to prepare the area for skin removal. Now, in this patient, we did liposuction at the time to help improve the contours. But in the back, it also just made the skin and the extra fat come off easier. It kind of pre-dissects it. So there's a technique to utilize to do liposuction in the area you're removing the skin beforehand that just facilitates the removal of the skin and makes it faster, easier, and with less bleeding.
Can you even begin to count how many of these surgeries that you've done?
No. And the good thing, I guess, at this point is that whenever anybody asks pretty much any procedures, like, how many have you done? It's like, I don't know. There's, it's a lot. And I don't ever, have to go home and say, oh, what am I doing tomorrow? I haven't done that in a while, and am I concerned about it? It's like, I don't look, I just show up and I do kind of what shows up for the day. And then when we do have an unusual thing show up around the office, something in that rarity, all of us get involved. We had a patient come in this week who myself, Dr. Weston, and Dr. Sigel all came in because it was just such an unusual case that we say, okay, how would you approach this? And we discussed it all in front of the patient and kind of laid it out. It's like, yeah, this is an unusual case. This is something that we don't see very often. And we'll also do that when somebody comes in, potentially maybe they've had surgery elsewhere and it becomes a very difficult case. And it's like, okay, look, this requires multiple minds to make sure that we kind of give you the best option. So that's nice to have that teamwork.
And I know we've talked in the past about how one of your favorite parts of your job is seeing the way that these surgeries transform people's lives after, but I'm assuming that this must be one of the perfect examples of that because this is beyond life-changing.
Yeah. These are some of the happiest patients that we see because there's something that often lingers in their mind that they've lost all this weight, and as they were going through their healing story, their journey. I think we talked a little bit about this at one of the past podcasts, but there was an anticipation that I'm going to lose all this weight and then things are going to be different. And then they lose all this weight and things are different. Their blood pressure is better. Their diabetes is, gone or improved. they've made such lifestyle changes, their energy's better. And then they look in the mirror and they've got all this freaking skin and they're depressed by what they see. They're like, had I known, I don't know, because they just are dissatisfied with that. And then we're able to address that. And so that's very rewarding. And then they become cheerleaders for you and bring in their friends and just keep the cycle going.
We love it. And with that, I'm going to say, yay.
Yay.
Hey guys, thanks for tuning in to this episode of Austin-Weston's New You Now podcast. If you liked what you saw or heard on today's episode, please like and subscribe to our channel. And if you have any questions about any of the topics we've covered today or in past episodes, send us an email at hello@austin-weston.com or just leave us a comment below. See you next time.
For more information, visit austin-weston.com or call our offices for a consultation, 703-893-6168. And make sure to subscribe to our podcast series, Austin-Weston, the Center for Cosmetic Surgery.